We've got Paul Seegert now joining us, managing partner of PCS Advisors. He's going to help us bring some clarity on the Supreme Court decision that came down yesterday. Paul, welcome back to Live from Seattle.
Thank you. How are you today?
Hey, I'm doing well. Yourself?
Doing great.
Good. Hey, give us the 411 here. And I know maybe some who are listening, I'm sure most have heard, but maybe not all know the details and everything. But give us the update on what's going on with the Supreme Court decision from yesterday.
Well, they had oral arguments at the end of last week on two of the mandates, one being the OSHA mandate, and the other was for healthcare workers that work in facilities that basically get money from the federal government as a payer. And those of us watching it closely, kind of expected that the OSHA mandate would not survive court challenges. The OSHA doesn't have a great track record when they use their emergency standard authority. 6 out of the 9 last times they've done this, and they don't do it very often, and this is probably the largest example of using that authority, or the most far-reaching. 6 out of the 9 last times it didn't survive court challenges, so that it really wasn't expected to survive, and it didn't. So the Supreme Court put a stay on it. It was a pretty unique situation where it's still in litigation in the Sixth Circuit, but the fact of should it be put on hold or not, was brought up to the Supreme Court. The last time they intervened in the middle of litigation to do something like this was about 50 years ago. So it's pretty significant. And 6 out of the 9 said we're going to put it on pause. So it's largely believed that that's a pretty significant nail in the coffin for the OSHA mandate. And that means that employers with more than 100 employees are not required, at least by OSHA, to have a vaccine mandate or testing policy and so on, like they were gearing up to do. And there's a lot to that story. Actually, if you asked me a few months ago how many employers in that subset of employers that have more than 100 employees would have a mandate by the end of 2021, it was 85%. That was what we were hearing from employers that we interact with around the country, and there were numerous polls that supported that. And so it's kind of a story of unintended consequences, because when the administration came out and said, we are going to pursue this route of an OSHA mandate, many of those employers put what they were doing on hold, because then they had an understandable fear that they would invest time and resources in putting in a policy that then wouldn't meet the muster of whatever the ruling, the kind of the specifics were that OSHA came out with. So they put it on hold. And when we closed out the year, only 18% of employers that would have fallen under this mandate had put one of their own in place, and only another 7% said they would, no matter what happened in court. And the balance, about 75%, said, we're going to wait and see what happens in court, because a lot had transpired by then. And they were now facing the Great Resignation, and depending on their industry, critical staffing shortages, healthcare as a good example. And so it looks to me like we're going to end up with a minority of employers, 25% or so, that end up with a mandate of some sort. And then when you flip over to the other issue that was at hand at the Supreme Court, the healthcare workers mandate for facilities that receive funds from CMS and so on. Basically, if the government pays them to deliver health care, then they were saying, if we're going to give you government money, your people have to be vaccinated. That survived. Roberts and Kavanaugh went with the 3 more liberal justices to give it a 5-4 majority in that direction.
Were you surprised by that one?
No, not really. No, there's much more precedent for. It's interesting that it's now kind of on a national scale. It has historically been more left to the states. I mean, we are a republic. But that one wasn't as surprising if you were listening to the oral arguments. So we kind of thought that would go that way. And I think they left open, and I'm glad they did, they left open some kind of release valves, you could say, that hopefully will allow some of the facilities to, frankly, continue to staff and provide services to the communities they serve, because that it's a really dire situation on the part of healthcare facilities. They were facing a staffing crisis prior to COVID, and they've had burnout. People have left from burnout. They've retired early. They've changed careers, and we're losing literally 500,000 nurses while we talk. And we're going to be at a 1.1 million staffing shortage on nurses nationwide this year.
Wow.
And so it is really a dire situation. I'll be speaking with a CEO of a rural hospital tomorrow, and the last time we talked, he shared with me, and that was before this news, that he was absolutely terrified of having to put in a mandate, because if he were to lose, he's already, like many facilities, 10, 15% down on staff. If he loses any more, he'll have to make some tough decisions. What services will we not offer to our community? So they're in a really tough spot. And this is how crazy we are in our COVID experience in this country. And it's pretty unique. Our peer countries, I think, have been actually a little more level-headed about it. But we're at a place where California just announced this in the last week. If you're vaccinated, so you did what you were asked or required to do or told to do, and COVID positive, because of staffing shortages in the healthcare industry, we'll let you work. Wear a mask, you can treat patients. If you're unvaccinated, and you could be somebody that already had COVID and has natural immunity and so on, but we're not talking about that. But if you're unvaccinated, you're fired. And so those unvaccinated people who were fired and could be COVID negative could be in there helping. I mean, we're really in a pretty crazy place in the conversation that we're having and the way we're handling this.
See, Pedro? I mentioned this at the top of the show, and Pedro just is like, man, that's the way it should go. No, I'm kidding. He didn't say that. What's that?
It doesn't even sound real.
I know. It's just, I mean, I just cannot get my mind around it, Paul.
1 in 4 hospitals in this country are reporting critical staffing shortages. I mean, that means the quality of the care that they're able to deliver is impacted. 1 in 4. And before this ruling, there were some very reputable healthcare organizations like the Cleveland Clinic and some others that are equally as prestigious that were saying we're not going to do this because it's more important that we can actually deliver healthcare to people than worry about if someone's vaccinated or not. And there's more than 90 studies now that say that natural immunity is a real thing. And you have so many experts that are scared to talk about it, really world experts, world-renowned experts, that are scared to talk about it because of getting whatever the blowback might be, that it will hurt their career.
Yeah. Well, apparently the NCAA is not worried about it. And I mean, that's the first kind of major organization I've heard of. You heard about this, right? They just changed their guidelines, NCAA, football, basketball, all that, to show that if you've had COVID, you are now considered fully vaccinated.
Before the mandate was announced, the OSHA mandate, there were healthcare organizations. Kettering Health is a good example of this in Ohio, where they asked their employees to get vaccinated or submit a medical exemption or a religious exemption or antibody tests to show that you had COVID and recovered. And there is actually precedent for that. Many states require, and really all states require healthcare workers to get vaccinated for certain diseases. And many states also allow for exemptions if you can show that you already have the disease. Because then it's scientifically not necessary. But we've just had a very narrow one approach. Vaccinate, vaccinate, vaccinate. That's the only answer.
Yeah.
And that's why we don't have testing available now, like
Right.
we should.
We're talking to Paul Seegert, managing partner of PCS Advisors, talking about the Supreme Court decision yesterday that came down. We got to go to a quick break, but we'll be right back with Paul right after this on Live from Seattle. We got Paul Seegert with us, managing partner of PCS Advisors, giving insight into the Supreme Court decision yesterday. Paul, what do you expect the impact to be of this decision?
Well, I think it's going to be very positive for the employers that were affected by the OSHA mandate. Many were telling us, and in many polls, numerous polls supported this, that they had legitimate fear that if they were to put this in place, they wouldn't be able to staff their company. 1 in 3 had serious concern that they wouldn't be able to staff their company. It's one thing if you have 67,000 employees and you're a big national airline or an international airline. It's another thing if you go down to the employers that were at the lower end of the spectrum of who would be affected. And some of our clients, as an example, who had skilled labor and craftsmen really working in their shop, and they might have 150 employees. If they lose 3 or 4 or 5 employees, they will not be able to fulfill contracts. And so they had this legitimate and serious concern as to how this would affect their business. So it's very good news, I think, and it doesn't preclude employers that want to put a mandate in from putting a mandate in. And there's plenty of precedent for that. Both sides agree, or all sides agree, that if you're an employer and you believe strongly in having your employees vaccinated, you can do that. And nobody would really speak out against that or be able to stop it, at least, because those folks can say, okay, I'm going to choose to work somewhere else. So that can still be done. I think it's good news for those employers, and I think it's really yet to be determined for the second mandate that they ruled on, the healthcare mandate. Hopefully the fact that exemptions are allowed will allow some of these more rural facilities to survive and continue to provide services for their communities. We've already, as a nation, been losing rural healthcare facilities and rural hospitals and safety net hospitals. If you're in an urban area, it's not something that you see, but there's hospitals that might be the only hospital within an hour or two, and if someone's having a baby, that's the only place they can go. And there's already, I'm looking at an article right now where 14 of them are temporarily or permanently closing some of the services they're offering because of staffing shortages.
Wow.
And so it's just a good example of the fact that one size may not fit all. If you were in one of those areas and you were to vote on it and say, should we have everyone vaccinated, or should I be able to go there and deliver my child and not have to drive 2-3 hours to do that? That's a different decision than being in an urban area. So there's a reason that more localized decisions might make sense.
Did you see, Paul, I think it was General Electric, they just came out here just recently, I think in the last couple hours, said they're going to take back their mandate. Did you see that? Yeah, and I'm not shocked by that. I mean, they too are dealing with the Great Resignation. I mean, we're in the toughest hiring environment in 15 years. And then you're going to make it even tougher. And employers are struggling already. Not only the toughest hiring environment, but we've all been through COVID. Some have been winners, but many have been losers out of the COVID experience. Yeah. Yeah, wow. Paul, so great to have you with us. Every time we have you on, you bring a lot of just insight and knowledge. We really appreciate you taking the time to join us on Live from Seattle today.
Thanks for having me.
Yeah, you bet. Night. That's Paul Seegert, managing partner of PCS Advisors.